Today I want to talk about mental health in the medical field. So this is an issue that has kind of been swept under the rug for many years among healthcare professionals, mainly because there seems to be a stigma attached to discussing mental health issues among medical healthcare professionals. And for me, I really think that this has to do with that element of trying to achieve perfection. Physicians, especially, are revered as professionals who have it all together. They're making the final diagnoses of patients and they have a lot on their shoulders. Even medical students in their training, a lot is expected of them. Actually, sometimes it's superhuman what's expected. The amount of hours that are put in for studying, the amount of exams that need to be taken to be licensed. So these are all factors contributing to this issue of mental health in the medical field among medical professionals. So I was looking on the American Foundation of Suicide and Prevention website, and I found some very alarming statistics. For example, suicide is a cause of death for about 300 to 400 physicians in the United States per year. And many of these cases happened when the physicians were not seeking mental health treatment. And the suicide rate among male physicians is 1.41 times higher than the general male population. And among female physicians, the relative risk is even more pronounced, 2.27 times greater than the general female population. And it's the second leading cause of death in the 24 to 34 age range, and accidents are first. And finally, unaddressed mental health conditions in the long run are more likely to have a negative impact on a physician's professional reputation and practice than reaching out for help early. So it seems that there are a lot of physicians who fear that, okay, if I go out and seek help for whatever mental health illness I may be battling, that's going to be a stigma for me in my practice. That's going to make patients less likely to trust me. That's going to make them less trusting in my ability to take care of them. But in actuality, I think that physicians and even anybody in general who actively seeks out help for their issues should be commended and should be even more trusted because they're being honest with themselves and they are addressing the issue at hand. So, why is it that there's such a stigma associated with it? And is it one that is just perceived among healthcare professionals, or is this really something that the general population fears? I haven't seen any documentation on whether or not patients are less likely to visit a physician who has a past medical history of mental illness, and what the stats are on the availability of this information to the general public. Because now many states do have rules and regulations which require physicians to report any mental illness which may prevent them from adequately caring for their patients, and patients do have a right to know about this as well. So my question is, what can we do as a community to ensure that these physicians and healthcare professionals are adequately taken care of and not stigmatized in the process? Because mental health it's so powerful, and we're seeing that more and more in the recent news and happenings in the world. When someone's mental health is challenged, it has an effect on them both physically, emotionally. It has such an important and a huge impact on their lives. Personally, I think that depression is a very common issue that you will see in the medical health field. And a lot of a lot of medical students are so hard on themselves because they're trying to, meet the expectations of the field, that when they fall short of these expectations, they can become depressed. And it's very easy to become depressed, especially when things are not going as planned, which happens a lot of times. So we need to make a sort of network that would enable both medical students, nursing students, all healthcare professionals, but particularly in the medical field, that would ensure that everyone feels supported and everyone feels that they are welcome to express their concerns. And it's really hard for a physician who works around the clock, and like when you don't have time off, when can you really sit with yourself and ask, okay, is everything okay with me? How do I feel? When can you really vent to people without being seen as weak in the field or, not up to the task? So I also, haven't really done much research on this issue in or with respect to other professionals, such as social work or engineering, any other field. But if you are familiar with this issue and you're in a different field, please feel free to comment below and let me know what your thoughts are. And also, are there any resources available for those employed in your field to reach out and actually get help for mental health issues? Because it's truly important in being able to adequately cater to your audience, whether that's patients, whether that's customers. So comment below, and don't forget to like and subscribe and let me know your thoughts and views on this issue. Until next time.